Welcome to our Facebook Live discussion. I'm Dr. Dean Seidlinger, the Health Officer and State Epidemiologist in Oregon.
And I am Bakosi Dube. I'm a physician with Oregon Health Authority. I'm also a senior health advisor. We're here today to answer your questions about what to do after you've been vaccinated. But before we do that, Dr. Seidlinger will give us a brief overview of the state of the pandemic here in Oregon.
Thanks, Bakosi. The spread of COVID-19 is accelerating throughout the state. We have seen an alarming rise in daily cases, percent positivity, and hospitalizations over the past several weeks. Our newest modeling indicates that the rate of transmission surpassed the most pessimistic scenario 3 weeks ago. And if that spread continues unabated, our hospitals risk being swamped by virus-stricken patients. Here are some of those troubling indicators. Daily cases have tripled since early March. Hospitalizations have more than doubled over the same time period. Additionally, we are seeing severe illnesses on the rise. On April 1st, there were 39 COVID-19 positive patients in intensive care units. And we are seeing more younger people in those ICU beds. The percentage of positive COVID-19 tests has climbed from a 7-day average of 3.9% in early March to an average of 6.7% as of yesterday. And on Friday, 15 Oregon counties will move into extreme risk due to this surge in COVID-19. Some difficult days await us, but how difficult and how long it lasts depends on our actions over the next few weeks. We all possess the tools to slow the virus by continuing to wear masks, by gathering more safely and maintaining physical distance. And of course, by getting vaccinated as soon as you're able.
There is some good news. About 1.2 million Oregonians have been completely vaccinated. That means that they've received both their doses in the 2-dose series or gotten the Johnson & Johnson vaccine, which is a 1-dose vaccine. And more than 1.7 million Oregonians have received at least 1 dose. This is reassuring, and this is very, very promising. Right now, we're vaccinating about 35,000 people a day, and we're encouraging more people to show up and get vaccinated as there are more appointments available. We have many tools in our toolkit to fight this pandemic. And one of the most direct ways is getting vaccinated. That's why everybody who's 16 and older is encouraged to get vaccinated as they're eligible for the vaccines. There are many ways you can get an appointment. The easiest way is probably to go through the Get Vaccinated Oregon web tool at getvaccinated.org.gov. The CDC also offers a finder tool at vaccinefinder.org. You just put in your zip code, and then it'll show you the appointments available that are near you. There's also 2 other ways to find an appointment. First one is texting OR COVID to 898-211 or emailing orcovid at 211info.org.
Let me add a note of caution about getting vaccinated. Getting the vaccine doesn't mean we can return to pre-pandemic life just yet. Until we see enough Oregonians vaccinated to stop the spread, we must continue with our preventive measures. This isn't forever, it's just for now. COVID-19 has proven to be a resilient enemy. The latest wave shows just how dangerous the virus is. New and more contagious variants are emerging, sickening our friends and neighbors, and even younger Oregonians. We cannot let this latest wave swamp our hospitals with virus-stricken patients.
So we have seen a lot of social media chatter on side effects and whether you can get the virus from the vaccine. So we want to set the record straight and ensure that people have the correct information to make an informed decision about getting vaccinated. We know that existing vaccines are effective at preventing serious illness and death from COVID-19. Side effects are perfectly normal, and they also indicate that your body is building the protection that you need to fight this disease. Many people will experience no side effects at all. Some will have minor side effects that include soreness at the site of injection, maybe some chills and fevers and headaches. But again, those indicate that your body is responding to the vaccine and making the antibodies required to fight the virus. People may be more likely to experience side effects after the second shot in the 2-dose series. That's because your body is building the immunity required. These are very, very short-lived and typically last about 12 to 24 hours. As a precaution, you may want to arrange to take it easy, or maybe take the day off following your second dose.
In addition to these mild side effects that many suffer from, there are occasions when people suffer adverse effects following the vaccine. Our nationwide system for safely monitoring vaccine safety is robust. Adverse events, even those that are extremely rare, are flagged by the National Vaccine Adverse Events Reporting System, or VAERS. The frequency of these events is extremely low. Tragically, the Oregon Health Authority announced last week the death of an Oregon woman following immunization with the Johnson & Johnson vaccine. She developed a rare but serious blood clot and had low levels of cells in her blood that caused clotting within 2 weeks following vaccination. This is the same condition that prompted a call for the pause in administering the Johnson & Johnson vaccine. Her death was reviewed by the Centers for Disease Control and the U.S. Food and Drug Administration. We recommend that people who have received the Johnson & Johnson vaccine watch for symptoms of this very rare but serious side effect that includes severe headache, abdominal pain, leg pain, or shortness of breath in the 3 weeks following their vaccine, and notify their doctor if they should develop these symptoms. Oregon health providers and pharmacies are now resuming administering the vaccine, and they have the information about this rare side effect that they can share with patients or caregivers to inform them about the risks and benefits of this vaccine.
You may ask why cases and hospitalizations are rising, even as we vaccinate more people every day. Most of these new cases are in people who have not been fully vaccinated, meaning people who have not completed the 2-dose series or people who have not received the Johnson & Johnson vaccine. There are, however, a small number of cases where someone was reinfected with the virus after receiving the COVID-19 vaccine. These are called breakthrough cases. These are people who get sick with COVID-19 at least 14 days after completing their vaccine series. Clinical trials of COVID-19 vaccines included these breakthrough cases. In those cases, even though the participants got COVID, what's important to note is that the vaccines reduced the severity of the illness. And this is very, very important to note. Even those people who got sick or got COVID after getting the vaccines, they were not hospitalized and the severity of illness was significantly reduced. The bottom line is getting vaccinated will enable all of us to resume the activities that we miss so much, like visiting our grandparents, attending football games, attending basketball games at the Motor Center, attending, going to the Thorns or the Timbers, going to restaurants with friends. Those are things that all Oregonians enjoy and would like to resume. So that's why we strongly encourage everyone to get vaccinated as quickly as possible. We are ready for your questions now. We want to make sure that we can get to as many questions as possible. So we'll only be taking questions on this topic today. So the first question is coming from Leslie. How effective are the vaccines against the variants? So what we know is that these vaccines are very effective against the variants that are currently circulating out there. There are some indications from the lab that they may not be as effective against the new variants as they are against the original strain. But our real world data and experience show that they prevent severe illness, as previously noted, and they prevent death as well. We'll wait for more data, but initial studies and initial results are promising.
Thank you. The next question is from Julia. What do I do if I lose my vaccination card?
So you can ask your provider or your primary care doctor to provide you a copy of your immunization records. If that is not possible, you can go to the immunization resource page on the OHA website to request your records. And that website will be posted in the information that we send out today.
Thank you. The next question is from Daniel. Will county-based restrictions be the same for vaccinated and unvaccinated individuals? For example, will there be adjustments to the group size rules if all members of a group gathering are vaccinated?
Thanks for that question, Daniel. Right now, the county-based restrictions are the same for those who are vaccinated or unvaccinated. But the CDC just released some updated guidance on what people who are fully vaccinated can do. And we're in the process of incorporating those into our OHA guidance. So we anticipate that across the state, in alignment with the CDC guidance, right now, people who are fully vaccinated can get together with other unvaccinated individuals in small gatherings, in indoor private spaces or outdoor private spaces without using their masks or physically distancing. Vaccinated individuals can get together with unvaccinated members from another household who are not at increased risk for severe disease in private settings without masks or without social distancing. You do not have to quarantine or stay home for 14 days in case you develop disease after you were in close contact with someone with COVID-19. You can exercise outdoors when you're not close to others without wearing masks. And you don't need to follow the OHA Oregon travel guidance and quarantine after you travel out of the state. You will still need to follow the recommendations from the CDC following international travel or other things. But there are already several things you can do once you're vaccinated.
Thank you. The next question is from Heidi. If I had a chain store brand pharmacy administer both vaccines without going through my chart, does the pharmacy directly notify Oregon Immunization Information System so that my immunization record is updated, or do I need to go through my primary care physician?
I can go ahead and take that one. Thanks for your question. Right now, we have our pharmacists and our mass vaccination sites using the immunization information system, which in Oregon is called Alert. So those vaccine doses you got at a chain store should be entered into Alert, and your healthcare provider, the next time you go to the office, should be able to pull those up, and they will be included in your broader record. So we try to maintain all doses of COVID-19 that are administered to folks in Oregon, regardless of where you got it, in that Alert IAS system.
There's a question from Lisa. Can you change guidelines to allow for vaccinated people to immediately be able to watch their children play sports or activities?
Thank you very much for that question. That would be a very good incentive to get people to get vaccinated. Unfortunately, we cannot discriminate against those that choose not to get vaccinated for religious or personal reasons. So as much as we would like to allow that to happen, at this point, we cannot do that.
And I would just add to that right now the CDC is updating their guidance in the Oregon health authorities following on saying what activities people can take place in once they're vaccinated. That depends not only on your vaccination status, but thinks about the risk to others if there are unvaccinated individuals in that setting. So that's why right now it's limited to smaller social gatherings inside or outside with other people you know, where you can assess their vaccination status, and not for people going into large crowds, indoors or outdoors, where we don't know the vaccine status of all those individuals around you. The vaccine offers great protection, but we want to make sure that in those settings, even though the risk is very low of transmitting COVID to someone else, that we don't do that by mistake or unknowingly because we don't have symptoms. We anticipate as disease rates go down and we learn more about the great effectiveness of this vaccine, that more avenues will open up to get together with families and friends once we have our vaccine.
The next question is about a workplace. If the majority of my employees or colleagues get vaccinated, can we drop the masks in the workplace?
I'll go ahead and take that one as well, because I think it follows on from the question we just answered for Lisa, and I think this question is for Ryan. Right now in the workplace, because we don't know the status of everyone in that workplace, and people can be together for multiple hours indoors at a time, we recommend that the safety measures in place, including wearing a mask and keeping physical distance, remain in place. That offers the utmost protection for everyone in that location and ensures that we have more time to get Oregonians vaccinated and have that protection across everyone. When we get the vaccine, we're doing it for ourselves, our loved ones, our coworkers, and our neighbors, and we encourage everyone to do that, to provide that protection across Oregon.
Question from Jill. How many have died from the vaccine, and are people getting COVID-19 from the vaccine?
So I'll take the second question first. It is not possible to get COVID-19 from the vaccines because you're not getting the virus when you get vaccinated. The two vaccines that we currently have, the two types of vaccines that we currently have, use a technology that does not require or does not give you a live attenuated virus. Then the second question is, the first question, I guess, is how many people have died from getting the vaccines? We have had 0 people die from getting the 2 mRNA vaccines. We unfortunately have had 3 deaths that have been associated with the Johnson & Johnson vaccine, and that these were women who developed, women between the ages of 18 and 49 who developed blood clots after getting the Johnson & Johnson vaccine. What's important to note, however, is that we have administered close to 7 million doses of the Johnson & Johnson vaccine and only had about 15 cases of this incredibly rare side effect. I've heard some experts say that you have a higher chance of getting struck by lightning walking outside than getting this incredibly rare side effect from the Johnson & Johnson vaccine. I don't know if Dr. Feidlinger would like to add something to that.
I just want to add to that. The death of the woman in Oregon and the 2 other deaths following blood clots after the Johnson & Johnson vaccine are tragic. And the pause was put in place after the initial 6 cases and 1 death were known, while our federal partners investigated more fully. They identified a total of 15 cases, as you heard, that had this rare complication, and decided to put an additional warning on there for those women under 50 to talk to their providers about the risks and benefits, knowing that we have other vaccines available. Some of you may also be hearing about numerous deaths that have occurred and been reported to the CDC following a vaccine. What we ask and what is required under our use of this vaccine is that any serious adverse event, any death within the 2 weeks following a vaccine be reported into the CDC. That doesn't mean we think that these are due to the vaccine, but we want to try and investigate and look for these rare causes. And so far, it's only this group of 15 that have been seen to have an effect, a side effect that may have been caused by the virus. So, we encourage to have all of these conditions reported in. They're examined thoroughly, so we can look to assure you that the vaccines continue to be safe as we use them in millions of people.
New question from Mel. What about the breakthrough cases? You talked earlier about people getting COVID from the vaccine.
Let me say that, Dr. Dubé didn't talk about people getting COVID from the vaccine. You can't do that. There's not a COVID virus in any of these vaccines. What we do look for is a breakthrough case. So someone who's 2 weeks out from their last dose of vaccine, if they get COVID, we call that a breakthrough case. While in the studies, the vaccine was 95% effective and prevented all hospitalizations and deaths. Those studies were done in tens of thousands of people. We've now given out tens of millions of vaccines in this country, and we're monitoring for those cases. They're very rare. As of April 2nd here in Oregon, only 168 people developed COVID after getting the vaccine. Not from the vaccine, but because they were exposed to someone after they were vaccinated and got the disease. Many of them didn't have symptoms and were picked up on routine screening. 19 of them required hospitalization, and tragically, 3 individuals who got COVID after the vaccine had died. But that was at a time when over 700,000 Oregonians had been fully vaccinated. This vaccine prevented disease in the vast majority of those people. It is incredibly effective at preventing disease in the real world, and is performing as well, if not better, than it did in those trials. So we're very lucky to have had these 3 vaccines developed during the course of this pandemic and available for us as an additional tool to combat this virus.
Question from Ryan. Are we allowed to ask for vaccine cards if someone in the workplace is saying they aren't required to quarantine after an exposure?
Public health will work with individuals who are identified as a contact of people, a contact of a person who has COVID-19. They can determine if that person is fully vaccinated, then they will not need to quarantine. Public health typically works with the individuals who are impacted and often receives reports from employers of who may have been exposed and will make that determination. We aren't asking employers specifically to check on the vaccine status of their employees. Public health is part of an investigation to people who may have been a contact of someone will help make that determination.
Question from Justice. Can you explain the similarities of the flu shot and the vaccine and the COVID-19 shot and the vaccine, please?
That's a very good question. So the flu shot is something that you get, is a shot that you get every year that is made essentially from a very good scientific guess as to what virus is going to be circulating in the community. The advantage of these vaccines is that they're very specific to this COVID-19 virus. And so they're incredibly, that's what makes them so effective against this disease.
I will say, some of you may have also been hearing about a booster shot or needing to get a COVID shot every year. We don't know that yet. What we do know is that these vaccines, we continue to look at how well they work. And the Pfizer vaccine, which we've been using the longest, shows that it's still working after 7 months. And it's still working really well, and we anticipate that will continue. But our pharmaceutical partners, the scientists, continue to work on vaccines to see if we may need an additional shot each year or every few years, or if we may need a different booster shot for the different variants, so that will be available should it become necessary. But right now, we anticipate that the vaccines you're getting will continue to provide you protection. And then when it comes time for the fall, that we'll be talking to you again about getting your flu shot. We'll see what the situation with COVID stands at that moment, but that will likely be the next vaccine we'll be asking you to get.
Question for Brittany. If vaccines work, why do we still have to wear a mask?
That's a very good question, Brittany, and thank you for that question. So as stated previously, we know that these vaccines work really well, and we know that they prevent severe illness, they prevent hospitalization at almost 95, 96, 97%. However, there are a few cases, as previously stated, where people can still get the virus after having been vaccinated. It is incredibly rare. However, this is still a possibility. And so because of that possibility, we strongly encourage people to continue wearing masks so that they don't get the virus and they don't spread the virus to others. These recommendations will likely continue to change as more people get vaccinated and as we reach that point of herd immunity that everybody's been talking about, which is when we'll have about 75 to 85% of the population being immunized.
Thank you. And that leads us into our next question from Judy. How long will it take us to reach herd immunity?
Thank you, Judy, for that question. So this is a moving target for one. Two, it's dependent on us Oregonians and how we respond to the efforts that the public health, our public health partners and the governor and the governor's efforts to ensure that people get vaccinated. So the sooner we get vaccinated, the sooner we get to herd immunity. What we were hoping for was possibly by this summer, June, July, but it all depends on us Oregonians, right? We need to encourage each other. We need to encourage our neighbors, our friends, our families that may be on the fence as to whether or not to get vaccinated. So go out there and spread the good news and encourage your family, friends, and neighbors to get vaccinated so that we can get to herd immunity.
Question from Melanie. If I got my second vaccine and 4 days later find out that I have been exposed to someone who tested positive for COVID, do I have to quarantine?
Thanks for that question. And unfortunately, you would still have to quarantine. What we know is that we see some protection from the vaccine about a week after the first dose and more protection following the second dose. But it's really 14 days after the second dose where we know you have full protection. So in those 14-day periods after that vaccine, if you're exposed, there is still a higher chance of you developing the virus than if you wait the full 14 days. You do have some protection, but we're going to ask you for the protection of those around you, your family, friends, coworkers, and others, that you would still quarantine until it's been 14 days since you received your vaccine.
Question from Joe. Why does it seem like the more people get vaccinated, the more cases we have?
Thank you very much for that question, Joe. And thank you for being observant with regards to that. So here's what we're seeing in the community. Yes, more people are getting vaccinated, and we encourage more people to continue getting vaccinated. The people who are getting the virus and getting sick and getting hospitalized are people who have not yet completed their vaccination series, and that's what the data is showing us. That's what our epidemiologists are telling us. So hence we're encouraging everybody to get vaccinated so that we don't have so that we have fewer people getting the virus and getting sick and getting hospitalized.
I don't know if we lost Tim, but it seems like we have one additional question that's come in. If we require vaccines in the workplace, are we allowed to ask for vaccine cards to show proof of vaccination, or is this protected? I will say that in Oregon, there are regulations that prevent employers in certain settings, healthcare settings, for example, that they cannot require vaccines. But in other employment settings, vaccinations can be required for workplace. So if you have a vaccine requirement in place, you can require proof of vaccination from your employers, I would encourage you to talk to your HR or your attorneys who deal with your employment law to see what steps you need to have in place to document that. Because in most settings, like you said, with some exceptions that are spelled out in Oregon statute, employers can require vaccinations for employees to return to work.
We are at 12:30 and our time is up. Thank you very much for engaging us and for joining us this afternoon. I would like to end with encouraging everybody to continue the COVID protective behaviors. Wear your face mask, practice good hand hygiene, good physical distancing, avoid large crowds, avoid traveling, and of course, get vaccinated as quickly and as soon as possible. Thank you again for this, for joining us this afternoon.
Thanks, everyone.